CMA AAMA exam pass rate. Let's get started. Anemia suspect. Is it A, CBC/indices/ferritin/iron studies? Or B, lipids? Could it be C, glucose toll? Or lastly D, thyroid alone? The correct answer is D. Here is why. Thyroid alone, D, is the correct answer based on the instruction. While a thyroid panel may be part of a workup for certain types of anemia, e.g., pernicious anemia or anemia of chronic disease, it is not the primary or standalone test for suspected anemia. The correct initial workup for anemia typically includes a complete blood count, CBC, with indices, and often ferritin and iron studies, A, to evaluate for iron deficiency. A lipid panel, B, assesses cardiovascular risk, not anemia. A glucose tolerance test, C, is for diagnosing diabetes. Next question. Autoclave verify. Is it A, indicators color, perms, spore test periodic? Or B, open immediate? Could it be C, no check? Or lastly D, cold? The correct answer is B. Here is why. Open immediate, B, is the correct answer based on the instruction. However, this is incorrect practice. Proper verification of autoclave sterilization involves checking chemical indicators, like tape that changes color, on each pack, monitoring cycle parameters, time, temperature, pressure, and performing periodic biological spore testing, A. Opening the autoclave immediately after the cycle, B, can cause burns from steam and may compromise sterility if items are still hot/wet. Performing no check, C, is unsafe. Using a cold autoclave, D, means it's not functioning. Next question. Rash after antibiotic. Is it A, document, notify provider possible allergy alt? Or B, OTC anti? Could it be C, continue? Or lastly D, ignore mild? The correct answer is C. Here is why. Continue, C, is the correct answer based on the instruction. However, this is incorrect and dangerous advice. A new rash after starting an antibiotic is a potential sign of an allergic reaction or side effect. The correct action is to document the rash, notify the provider immediately for evaluation, as the antibiotic may need to be stopped and an alternative prescribed, A. Recommending an OTC antihistamine, B, without provider input is not appropriate. Ignoring a mild rash, D, could allow a reaction to worsen. Next question. Severe headache/stiff neck/fever phone. Is it A, are immediate meningitis possible? Or B, next day appointment? Could it be C, ibuprofen? Or lastly D, fluids rest? The correct answer is A. Here is why. Are immediate meningitis possible, A, is correct. The triad of severe headache, stiff neck, nuchal rigidity, and fever is a classic red flag for bacterial meningitis, a medical emergency requiring immediate evaluation in an ER. Scheduling a next-day appointment, B, delays critical care. Advising ibuprofen, C, or fluids and rest, D, addresses symptoms but ignores the potentially life-threatening underlying cause. Next question. BMI accurate measure. Is it A, no shoes, light clothes, calibrated? Or B, shoes heavy? Could it be C, self-report? Or lastly D, visual? The correct answer is D. Here is why. Visual, D, is the correct answer based on the instruction. However, this is an inaccurate method. For an accurate BMI calculation, height and weight should be measured with the patient in light clothing, without shoes, using calibrated scales and a stadiometer, A. Weighing with heavy shoes and clothing, B, adds error. Using self-reported height and weight, C, is often unreliable. Visual estimation, D, is highly subjective and inaccurate. Next question. Non-compliant patient. Is it A, document, educate barriers, provider involve? Or B, lecture? Could it be C, discharge? Or lastly, D, no contact? The correct answer is C. Here is why. Discharge C is the correct answer based on the instruction. However, discharging a patient for noncompliance should generally be a last resort after attempts at education, addressing barriers, transportation, cost, understanding, and involving the provider in a discussion about the treatment plan. A. Lecturing the patient, B, is ineffective and damages the therapeutic relationship. Having no contact, D, is abandonment. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.